9 warning signs of diabetes. Hidden in your feet. After 60. Open and hook. What your feet may be trying to tell you. What if your body has been warning you about diabetes, and you've been ignoring those signs every single day? What if the first symptoms of dangerously high blood sugar are already visible? Not in a blood test, not in a doctor's office, but right there on your feet. And what I'm about to reveal today could completely change how you look at your health. Most people believe diabetes is only discovered after a routine blood test. You go to your doctor, they run lab work, and then one day you hear the diagnosis. But after more than 20 years of medical practice, I can tell you something many people never realize. Your body often starts warning you years before that diagnosis ever happens. And one of the very first places those warnings appear is your feet. That's exactly why I'm making this video, because I've seen far too many patients walk into my office and sometimes into the emergency room after ignoring warning signs that had been right in front of them for months, sometimes years. And today, I want to make sure that doesn't happen to you. A real story that changed everything. Just last month, I met with a 67-year-old retired man. He looked healthy. He exercised regularly. He felt perfectly fine. He came in for a routine checkup. Before ordering blood work, I asked him a simple question. Have you noticed anything unusual about your feet? He laughed and said, well, they've been a little numb lately, but I figured that's just part of getting older. When I examined him, he had 4 of the 9 signs I'm about to show you today. His fasting blood sugar came back at 214. He had type 2 diabetes, and based on his numbers, he had likely been living with it for more than 2 years without knowing it. That's how silent diabetes can be. So today, I'm going to show you the same warning signs I showed him. For each sign, I'll explain what most people assume it is, what's actually happening inside the body. And one simple habit that can help protect you, because according to the American Diabetes Association, nearly 1 in 5 adults with diabetes don't even know they have it. That's millions of people walking around right now, while high blood sugar quietly damages their nerves, their kidneys, their vision, their heart, and yes, their feet. Let's begin. Sign number 1, tingling or numbness. This is the most commonly ignored warning sign. Patients often tell me my foot just falls asleep sometimes. And yes, occasional numbness can happen, but if it's happening regularly without a clear reason, pay attention. This is often the earliest stage of peripheral neuropathy. High blood sugar slowly damages the protective outer layer of your nerves. Think of your nerves like electrical wires. Each wire has insulation. When blood sugar stays high, it gradually erodes that insulation. At first, the signals become fuzzy. That fuzziness feels like tingling pins and needles, mild numbness, strange buzzing sensations. The scary part? This damage can begin years before diagnosis. What helps? A 20 to 30 minute walk every day. Walking improves circulation and helps deliver oxygen to fragile nerve tissue. Also start reducing sugary drinks, white bread, candy, processed snacks. Even small reductions matter. Sign number 2, burning feet at night. If your feet feel like they're on fire when you lie down at night, don't ignore it. This is another classic early diabetes symptom. Here's what's happening. Damaged nerves begin sending false distress signals to the brain. Your brain interprets those faulty signals as heat or burning. It's like a smoke detector going off even though there's no fire. Many people lose sleep because of this symptom. Poor sleep then raises stress hormones like cortisol, which can increase blood sugar even more. It becomes a vicious cycle. What helps? Stay hydrated. Increase fiber intake. Avoid heavy sugar intake after dinner. A stable evening blood sugar level can dramatically reduce nighttime nerve irritation. Sign number 3, cuts or blisters that heal slowly. This is where things become dangerous. A tiny blister, a small crack, a minor scrape, and weeks later, it's still there. Why? Because elevated blood sugar damages blood vessels. That means oxygen and healing nutrients can't reach injured tissue efficiently. Without proper blood flow, healing slows dramatically, and slow healing wounds can become infected. This is one of the leading causes of diabetic foot ulcers. Daily habit. Inspect your feet every night. Look between the toes, around the heels, along the soles. Catch problems early. Sign number 4, darkened or reddish skin around the ankles. This sign hides in plain sight. People often assume it's just age. It's dry skin. It's poor circulation. And while poor circulation is true, the cause may be diabetes. When blood vessels narrow, oxygen delivery decreases. Skin changes color as a distress signal. You may notice dark patches, redness, purple tones, shiny thin skin. These are circulation warning signs. What helps? Every morning, 20 ankle circles, toe raises, calf stretches. These simple movements stimulate blood flow. Sign number 5, deep cracked heels. Cracked heels aren't always cosmetic. Diabetes can damage autonomic nerves that control sweat glands. Without natural moisture, the skin dries from the inside out. Over time, skin thickens, hardens, splits. These cracks can become entry points for infection. What helps? Moisturize nightly. Use unscented lotion, coconut oil, urea-based foot cream, and drink enough water during the day. Sign number 6, swollen feet and sock marks. If your socks leave deep marks every evening, pay attention. Persistent swelling may indicate fluid retention. High blood sugar can stress the kidneys, and kidneys regulate fluid balance. When they struggle, fluid collects in the lower legs and feet. What helps? Reduce sodium. Elevate feet while resting, stay active, and mention it to your doctor. Sign number 7, sharp stabbing foot pain. Many people assume this is arthritis. Often it's nerve pain. Damaged nerves can become overactive. They fire random pain signals like electrical shocks. Patients describe stabbing pain needle sensations, sudden jolts, especially at night. What helps? Gentle stretching before bed, 5 minutes makes a difference. Sign number 8, constantly cold feet in winter, normal. Cold feet in summer under blankets, that's different. This often means circulation has been compromised. Warm blood simply isn't reaching the feet efficiently. What helps? A brisk daily walk. Movement forces blood into the lower extremities. Sign number 9, hair loss on the feet and lower legs. Almost nobody notices this. Hair follicles need oxygen-rich blood. When circulation weakens, hair growth stops. This is often a visible sign of vascular damage. Look closely. If hair has disappeared from the tops of your feet or lower legs, schedule a blood sugar test. The 30-second check that could save your health tonight before bed. Take 30 seconds. Sit down. Look at your feet. Check for numbness, burning cracks, color changes, swelling wounds, hair loss. Those 30 seconds could change everything. Final message, one of the hardest moments in medicine is telling someone, if we had caught this earlier, we could have prevented much of the damage. You now know what to look for. That gives you power. And the beautiful truth is this: type 2 diabetes is often manageable, especially when caught early. Sometimes all it takes is better nutrition, daily movement, better sleep, early medical attention. Please don't ignore what your body may be trying to tell you. If this video helped you, share it with someone you care about, a parent, a spouse, a sibling, a friend, because one shared video could lead to one early diagnosis, and that diagnosis could save a life. I'm Dr. Richard Ben. Stay aware, stay proactive, take care of your feet, and I'll see you in the next video.